Hello, I'm Dr. Anthony Colantonio, and I'm here to tell you a little bit about what are called care management never events. There are some things that should never happen in a hospital, and we're going to discuss them, those things that should never ever happen. You can take steps yourself to make sure these never events never ever happen to you, and you will reduce your chances of complications. Take a look at our first slide to see what I'm talking about. This is a list of the never events that, in general, have to do with mistakes by non-physicians. This is a list of care management never events, and they are injuries associated with, number 1, a contaminated drug, number 2, air embolism, number 3, a medication error, number 4, incompatible blood, number 5, hypoglycemia, number 6, a stage 3 or 4 pressure ulcer or bed sore, number 7, electrical shock or burn from a fire, number 8, a fall, and number 9, the use of restraints. Let's talk about them separately. Number 1, the contamination of drugs is a serious problem in our healthcare system. Here are some helpful hints on how you can reduce your chances of receiving a contaminated drug. And for that, let's go to slide number 2. Number 1, demand that all of your medication comes from an unused vial and an unused bag. Number 2, demand that the solution used to mix the medication comes from an unused bottle or an unused bag of solution. Number 3, demand that the medication used was not previously sent to the nurse's station for another patient, then returned to the pharmacy only to be recycled and used for someone else, you. Number 2, air embolism, which is air that is introduced into your bloodstream by a doctor or a nurse who is rushing or not paying attention to what they are doing. This can be a life-threatening emergency. There are ways that you can prevent the air bubbles, and for that, let's go to slide number 3. Number 1, when the doctor or nurse is injecting your IV tubing, be sure to ask them to be very careful not to introduce air into the syringe or into the tubing. Number 2, pay attention while they are injecting the solution and stop them if you see an air bubble. Number 3, if you see air in the IV tubing, bring it to someone's attention immediately. If someone is not responding to the bedside buzzer and you are not allowed out of bed, then shout into the hallway to get someone's attention. If no one comes to your aid, pick up the hospital phone and call the hospital operator by dialing 0 to get them involved, and to call the nurse's station or to call administration to get someone to help you. Air embolism can be an emergency and you could die. Medication errors are very frequent and happen all day long. You must ask the nurse or the doctor what the medication is before you take it, and be sure the medication is meant for you. A simple way while in the hospital to keep track of your medication is to ask the nurse to print out your medication list every day, first thing in the morning, including when the medication should be given. This list is provided to the nurse by the pharmacy department, so all that needs to be done is to copy it for you. Use that list throughout the day and every day, and check off the medication as you receive it. If you are too sick to keep track of the medication, then appoint someone in your family to check the list every day and be sure all is in order. The more medications you are to receive, the more room for error, which means you or someone else must keep track of everything. Number 4, incompatible blood transfusions. If you are receiving a blood transfusion, know what your blood type is and know what blood type of the blood to be transfused is. You must ask the nurse to print out your blood type and keep that sheet by your side. You must be sure that your wristband is clearly and correctly printed to your name and location in the hospital. Number 5, allergies. If you have allergies to medications or to foods, make sure there is a sign on your room door and on the wall above your bed and somewhere on your person, most commonly on a wristband. Number 6, hypoglycemia, which is low blood sugar, which is a life-threatening problem and a very common occurrence in the hospital. If you are a diabetic, you must be sure of not only the amount of insulin that you are about to receive, but also the type of insulin. Insulin comes in different types, and some act immediately in your bloodstream and last a short while, and others take a long time to start acting and last a long time. Be sure you are getting the correct amount and the correct type. Speak up, open your mouth, ask questions. Number 7, bed sores, which are sores on your skin from the pressure of lying down and not being able to move around. The sores can get very deep and go into the fatty layer of the skin or into the muscle or bone. The deeper the bed sores, the stage 3 or 4 bed sores, go into the muscle and bone and should never, ever happen. In general, bed sores happen in patients who cannot speak up for themselves and the patients are neglected. Stage 3 or 4 bed sores should never, ever happen. And we have examples of what they look like. These are examples of stage 3 and stage 4 bed sores. If your family member is hospitalized and can't speak up for themselves, ask the nurse every day if your loved one has a bed sore. Hospitals should take photographs every day of the lower back and buttock area. Ask the nurse or the doctor to show you that particular day's photograph. Be sure diapers and bed pads are changed very frequently. Number 8, restraints, which are the straps and the vests that are applied to a patient's wrist, ankles, and or chest to stop them from moving around and getting out of bed or out of their chair. Many times, these restraints are improperly used by hospital staff. This is a never event where your loved one really requires your help. Most patients that are restrained are unable to protect themselves because they are at the mercy of the person suggesting the restraints and the doctor ordering the restraints. You must help this family member or loved one by checking the restraints and being sure the restraint protocols are followed and the restraint forms are completed properly. Ask to see these forms every day. There are rules regarding the types of restraints and the amount of time that restraints can be used, and when restraints should be checked for injuries. Be sure to ask to see this form and be sure the form is followed and completed every single nursing shift. Number 9, falls and burns in a hospital setting happen every day. Burns happen from electrical fires or hot liquids. Falls happen when spills are not cleaned up right away or the patient is not properly observed and or not properly assisted. Keep the area around the bed and bathroom free of clutter and free of dirt and liquids, and that is the first thing you can do to help yourself and your loved one. If your loved one is unable to protect themselves, then you must be sure they are observed properly, and if needed, they are observed constantly with what is called a one-to-one nurse's aide. If your loved one becomes the victim of a fall or a fire or a burn, ask to see the fall or fire or burn report that must be filed with the local or state Department of Health, and be sure that the report is completed properly and filed properly. If not, then you should call the local or state Department of Health yourself. You can find that number on this website and report the incident yourself. This will hopefully prevent this injury from happening again to your loved one and also to others. If you would like to hear more about other never events, ones that are called surgery never events, please see our video on that topic included on this website. If you or your loved one has been injured and you need advice on whether to report the incident or how to report the incident, please call me. The toll-free number is 855-832-5757. The call is free, the advice is free. Just call the number and be sure to ask for me. Ask for Dr. C. Thank you very much.